So do you know how much a normal CT scan is supposed to cost? What about a knee replacement or even a C-section? The New Mexico Department of Health is making it easier now to see those prices before you get the bill and how much money you could save getting the procedure at a different hospital. Griffin Rushton explains what you need to know.
This is an effort to pull back the curtain on healthcare costs.
And New Mexico Health Secretary Patrick Allen says more transparency is always a good thing when it comes to healthcare.
That's not to say that there should never be differences in prices. Lots of times there are good reasons for those differences. But if you know what those differences are, whether you're an individual consumer or a policymaker, you can start having conversations and asking questions about why.
The all-payer claims database officially went live on Monday after nearly a decade of work behind the scenes. It includes more than 160 million insurance claims collected between 2020 and 2024 and other payment information to give New Mexicans a snapshot of how much health care costs in our state.
They'll be able to go into the website and they'll be able to search for what do different hospital systems and healthcare providers charge for knee replacement surgery.
Of course, these are just the typical prices. You'll notice many procedures listed in the database specifically note without complications, which can significantly affect the final bill. The benefits for patients is obvious, but Allen says the database also includes crucial information for state leaders.
Let's say we know that in a particular part of the state, there's a whole bunch of demand for services, but they're getting them somewhere else. Well, can we find a way to get those services in that part of the state? Legislators and their staff and health agencies are all now able to use this data in a way to try to get what we call the triple aim of better care, better health, and at lower cost.
And again, that was Griffin Rushton reporting. That new database is available right now. Secretary Allen told state lawmakers this week the health department is still working to add even more data, and there are plans to provide a Spanish language version in the future.